A vial of insulin in the United States costs around $98. The same vial, made by the same pharmaceutical companies, sometimes in the same factories, costs around $9 in France, $12 in Canada, $11 in Germany, $9 in Spain, $10 in Italy. The drug has not changed. The science has not changed. The company has not changed. The only thing that has changed is which country the patient lives in. And the country where they pay 10 times more is the one that calls itself the greatest medical system on earth. When the man who discovered insulin, Frederick Banting, sold his patent to the University of Toronto in 1923, he sold it for $1. One. He said, and this is a direct historical quote, that insulin belongs to the world, not to him. A century later, his discovery is being sold to American diabetics at a markup that has caused people to ration their doses, share vials with strangers on the internet, and in some cases die. Outside the United States, this story is not seen as the price of innovation. It is seen as something much closer to medical extortion. And it is only the first item on the list of things about American healthcare that the rest of the world finds genuinely difficult to understand. In every other wealthy country on earth, if you fall sick, you go to the hospital, you receive care, you go home. The financial question never enters the conversation because the financial question was answered before you were born. In the United States, every interaction with the medical system contains a hidden second conversation, the one about money, about deductibles, about networks, about whether the doctor you are about to see is technically part of the same insurance plan as the hospital they work inside. This conversation does not exist anywhere else. So today, 10 specific things about American medicine that nobody outside America understands and that almost nobody inside America can explain to a foreigner without flinching. If this is the kind of calm, evidence-based look at the world you came here for, do one thing before we continue. Hit subscribe, drop a like, and in the comments, tell me where you live and what an emergency room visit, a regular doctor's appointment, and a basic medication actually cost in your country. Real numbers, not opinions. Because the contrast is the entire point. The first thing is insulin, which is already covered, but the scale deserves repeating. According to a 2024 RAND Corporation report commissioned by the United States Department of Health and Human Services, average gross insulin prices in the United States were nearly 10 times the prices in 33 other developed countries. Even after accounting for rebates and discounts, Americans still paid more than twice the international average. Diabetics in the United States have died because they tried to stretch a vial to last longer than it should. There are documented cases. Their parents have buried them. In France, the same drug cost the price of a sandwich. Number 2, the EpiPen, the device used to stop a fatal allergic reaction. In the United States, it sells for around $300 per injector and is typically sold in 2 packs at $600. In the United Kingdom, the same drug and the same delivery device costs around $61. In Australia, $66. In France, $76. In Canada, $80. The drug inside the EpiPen is epinephrine, which has been off patent for decades and costs roughly $1 in raw chemical form. What Americans are paying for is not the medicine. They are paying for the plastic auto-injector and the legal monopoly that prevents competitors from entering the market. Mylan, the company that owned the EpiPen brand, raised its price by more than 400% in less than a decade. The CEO's pay rose by more than 600% over the same period. The rest of the world looked at this story and assumed there must be a criminal investigation. There was not. The third is the ambulance. In most countries, an ambulance is part of the public emergency service. You dial the emergency number, the ambulance comes, and that is the end of the financial transaction. In the United States, the average ground ambulance ride costs between $940 and $2,100, depending on the source. An air ambulance can cost $30,000 to $50,000. According to a Kaiser Family Foundation analysis, around 51% of emergency ambulance rides result in surprise out-of-network charges. Ground ambulances were specifically excluded from the federal No Surprises Act, which means that even with insurance, you can be billed thousands of dollars for the ride that saved your life. There are documented cases of Americans refusing ambulances and asking bystanders to drive them to the hospital because they did the math in their head while having a stroke. There is no other developed country where this calculation happens. The fourth is the existence of GoFundMe as a tier of the American healthcare system. According to GoFundMe's own published data, around $3 billion was raised on the platform for medical expenses in 2024. Roughly 1/3 of all campaigns on the entire platform are for medical bills. Think about what that sentence actually means. The largest crowdfunding site in the world has as its largest single category sick people begging strangers for money. The American Cancer Society published research last year showing that more than 1/3 of cancer-related GoFundMe campaigns mention medical financial hardship as the reason for asking. In every other developed country, the idea of running a public fundraiser to afford chemotherapy is a foreign concept. In the United States, it is so normal that the platforms designed for it are publicly traded businesses. The fifth is surprise billing. In the United States, you can go to a hospital that is in your insurance network, see a doctor at that hospital, and then receive a separate bill weeks later from an anesthesiologist or a radiologist or a pathologist who was technically out of network, even though they work inside the in-network hospital. You did not choose them. You could not have chosen them. You were unconscious. In the rest of the world, this concept does not exist because the rest of the world does not have a network system at all. A hospital is a hospital. A doctor is a doctor. The bill is the bill. The American system has created an entire shadow industry of people whose job is to read medical bills and find the surprise charges before they go to collections. That industry employs thousands of people. Outside America, those people would be unemployed because their job would not need to exist. If this is hitting the way I think it is hitting, do me one favor. Share this video with one American friend who could use a calm walkthrough of what their country looks like from the outside, and one non-American friend who can confirm what is being said here. Word of mouth is how this channel grows. Now let us keep going. The sixth is prior authorization. This is a system where a doctor prescribes a treatment, a medication, a scan, or a procedure, and then an employee at the insurance company who has no medical training, often no medical degree of any kind, decides whether the patient is allowed to receive what the doctor has ordered. In the rest of the world, when a doctor prescribes something, the patient gets it. In the United States, the doctor's order is the beginning of a negotiation with a corporation. There are documented cases of cancer patients dying while waiting for prior authorization to be approved. ProPublica has published multiple investigations showing that United Healthcare and Cigna used algorithms to deny claims in batches of thousands without a single human physician reviewing the medical records. One internal Cigna review reportedly took an average of 1.2 seconds per denial. A second. That is the amount of time the system spent deciding whether the treatment a doctor had prescribed would be paid for. A surgeon, a specialist, sometimes a Nobel Prize adjacent oncologist, was overruled in 1.2 seconds by software that has never seen the patient. The rest of the world reads these stories and assumes they describe an authoritarian regime. They describe the American health insurance industry. The seventh is the hospital bill itself. In the United States, the same Tylenol that costs 5 cents at a convenience store can be billed at $15 to $30 when administered inside a hospital. A single aspirin can be billed in the same range. A bag of saline solution, which costs a hospital roughly $1 to acquire, can be billed at $100 to $1,000 to a patient. Hospital pricing in the United States is so opaque that hospitals themselves often cannot tell a patient what a procedure will cost before they perform it. In every other developed country, prices are publicly negotiated between the government and providers, and there is a published rate. In the United States, there is no published rate. There is the charge master, which is the inflated list price. There is the negotiated rate, which only certain insurance plans get. There is the cash rate, which uninsured people pay. And there is the actual cost, which nobody can find. Foreigners trying to understand this system often give up. The eighth is childbirth. In the United States, the median cost of a vaginal hospital delivery was around $8,600 in 2022, according to Statista's International Comparison. In Germany, the same delivery costs around $1,361. That is 1/6 of the price. For a cesarean section, the United States again ranked first in cost, and the outcomes are not better for the higher price. According to the Centers for Disease Control, the United States maternal mortality rate in 2023 was around 18.6 deaths per 100,000 live births, with Black mothers experiencing 50.3 deaths per 100,000. In Norway, Ireland, Switzerland, and Italy, the maternal mortality rate is below 3 deaths per 100,000. The United States is paying 6 times the price for outcomes that are 6 times worse. Outsiders look at this and ask the obvious question: what exactly are American mothers paying for? Number 9, medical debt collections. According to research published by the Consumer Financial Protection Bureau and the Kaiser Family Foundation, around 100 million Americans carry medical debt. The CFPB has documented around $88 billion of medical bills sitting on Americans' credit reports, dragging down their credit scores, blocking them from car loans, apartments, and in some cases, jobs. American hospitals routinely sue their own patients in court to collect unpaid bills. There are nonprofit hospitals, which by law are supposed to provide charity care, that have been documented suing low-income patients for amounts under $1,000. American workers regularly delay treatment, skip recommended screenings, and avoid doctor visits because they cannot afford the bill that will come weeks later in the mail. Surveys consistently show that roughly 40% of Americans say they would not be able to cover an unexpected $400 emergency without borrowing or selling something. In every other developed country, the concept of medical debt is so rare that there are no national statistics on it because there is nothing to count. In the United States, medical debt is the leading cause of personal bankruptcy and has been for over 2 decades. The 10th is the LIE at the center of all of this, which is the phrase, the best healthcare system in the world. This phrase is repeated by politicians, by news anchors, by the system's own beneficiaries, with the same confidence as a fact of physics. The data does not agree. The United States spends nearly twice as much per person on healthcare as the average of comparable wealthy countries, and yet life expectancy in 2024 was 79 years compared to an average of 83 across peer nations, according to data from the Peterson and KFF Health System Tracker. Infant mortality is higher than in peer countries. Maternal mortality is higher. Preventable deaths are higher. Chronic disease outcomes are worse on most measures. The United States has the most expensive system in human history and ranks middle of the pack, sometimes worse, on the actual outcomes that determine whether you live or die. The phrase, the best healthcare system in the world, is not a measurement. It is a sentence Americans were taught to say. The rest of the world stopped believing it decades ago because the data stopped supporting it decades ago. What is happening here is not a healthcare system in the way the rest of the world understands the term. It is a financial product wearing the costume of a healthcare system. Every other developed country treats medicine as infrastructure, like roads or fire departments or schools, something the public funds so the public can use it. The United States treats medicine as a market, and a captured market at that, where prices are not set by competition, but by monopolies, networks, and the legal inability of patients to negotiate when they are unconscious or terrified. That structural difference is why a vial of insulin costs 10 times more in Dallas than in Paris. Even though the drug is identical, it is not because America loves freedom more, it is because America priced freedom into the bill. Number 17, meatloaf with tomato glaze and green beans. If you made it this far, 2 things. Tell me in the comments which of these 10 was the most shocking to you, especially if you live outside the United States and you grew up assuming the American system must be world class because the movies always made it look that way. And subscribe so you do not miss the next one, because we are turning this exact lens on a system that almost every country on earth shares, including the country most viewers will not expect. Thank you for watching a video that walks through 10 difficult truths without flinching. Thank you for being willing to look at the numbers instead of the slogans. And thank you for being the kind of person who can hear an uncomfortable answer and still want a clearer question, because that is who this channel was built for. If that does not bump your head, nothing will.